Great, welcome everybody. Hello. Good morning. I hope you all, good morning. Thank you. I hope you all got some coffee and breakfast and you're all well fed, and I hope you met some new friends this morning. I hope you got a chance to look at some amazing artwork out in the hallway over here. If you haven't, you'll be hearing about it throughout the day. Definitely take a tour. I hope you had a chance to meet some of our artists, some of our community members, some of our scientists, some of our government agency representatives, our foundation representatives. We have quite the mix of people in the room today, and I just couldn't be happier. I'm Kimber Bogard, and I'm a senior officer at the National Academy of Medicine, and I oversee all the activities of the Culture of Health program. I'm going to give a presentation of the Culture of Health program for you all, just to ground everybody in sort of the larger program that this meeting is a part of. Oh, thank you. There we go. All right, so the Culture of Health program is really a partnership with the National Academy of Medicine and the Robert Wood Johnson Foundation. The program was established in June of 2015 to develop the evidence base and answer critical questions about how to create and sustain a culture of health. The Robert Wood Johnson Foundation asked the National Academy of Medicine to assist in delineating causes of and solutions to health inequities in the United States. Over 5 years, the NAM, with input from an advisory committee, which I hope you all meet some of our advisors, are sprinkled throughout the room as well, will convene several activities on this topic, and this Engaging Allies platform is just one of those activities. And what's really important is to look at the mission of the program, or what we call also our key objective. This is our guiding light to identify strategies to create and sustain conditions that support equitable good health for all Americans. I'm going to pause here because I forgot to mention our online. We have a couple hundred people on webcast today, so I want to welcome our folks on webcast, and we will be engaging our online community through Poll Everywhere. Just about after every single session, we'll be getting comments, and we'll be asking our online community as well as folks in the room questions. So you'll be seeing how we engage our online community as well. So welcome to those on Poll Everywhere. So there are 4 goals that we've outlined for the program that aligns with the mission that you just saw. So the first goal is to lead. So we lead in identifying a set of consensus study topics that build upon one another, leading to a solid knowledge base that can inform a set of actions and partnerships to advance health equity. The second goal is to translate, to bridge the science to action for impact on health equity and optimal health for all. The third goal is impact. So impact, there's 2 strands. One is to strengthen community capacity, and to also inform legal and policy and systems reform as well. So working at the community level, working at the policy level, both local, state, and national levels. The fourth goal is to sustain, to transform culture in the United States, to sustain the progress that's already been made, and to accelerate progress in areas that still show significant health disparities. We do this through convenings and through partnerships. So I'll just go briefly through some examples of how we're aiming to achieve those goals. So the first goal, which was to lead based on our consensus studies, the first study was Communities and Action, Pathways to Health Equity. I'm glad to see Rose Martinez here, the board director who actually led that study. And some key messages came out of that study. It's a 500 or 600 page book, so I can't go through everything here, but everything's available online. You'll find briefs and highlights out at the table, but just briefly, there are a couple very key messages. So health equity is crucial and health inequity is costly. The committee who produced this report and authored this report also identified some root causes of health equity, being structural inequities and also unequal allocation of power and resources. And they also identified 9 social determinants of health that need to be addressed if we're going to address health inequities in the United States. Those include the physical environment, public safety, social environment, transportation, education, employment, health systems and services, housing, income, and wealth. So you see why we need a diverse array of voices coming to the table and working together as allies in moving this agenda forward. In addition, the report profiled 9 communities. There are case studies of 9 communities, and you will meet some of our community folks in the room here today. We will be launching the next 2 consensus study reports in the next several weeks, and they aim to build off this first study in the series. They'll take a life course perspective in applying the science of how neurobiological and socio-behavioral factors from the prenatal period through adolescence interact with the environmental context over time, including the social distribution of risks and resources that were identified in the first study, to influence health and well-being. We also, as part of our translating goal, we do a number of communications activities. We have our wonderful communications team here. You all want to raise your hands because they're really responsible for a lot of the art and communications activities that you're going to see throughout the day. So including the community video series, which you'll see 3 amazing videos that they helped to usher through to production. Sarah Klein is here somewhere perhaps, or maybe not yet, but she was the director of those videos. You'll hear her on a panel later today as well. And then they also produce a Community Health Heroes Spotlight series. You can find a lot of these materials online. I mentioned briefly in the beginning the art installation, Visualize Health Equity is what this is called. And this is really related to our 4th goal as well on sustaining. So how do we sustain and how do we continue to advance health equity in a sustainable way through partnerships and identifying new partners and stakeholders. So really changing the culture and creating sustainable change in how we view health and how we view health equity. So as I mentioned, we have some of the artists in the room today. You'll see some of the art, you'll hear it on one of the panels today, and you can see many of the other installations in the hallway. We've also this summer embarked on some community level work, and Charlie Alexander is going to be talking about that on a session today with some of our new community partners as well. So this today is another one of our activities that we're doing to try to help achieve our goals, move us toward our mission, the Engaging Allies in a Culture of Health movement. So the first stakeholder meeting was held in January, and those key objectives were just to introduce the program, to present the findings and recommendations from the Communities in Action report. It had just been released a couple weeks earlier before that meeting, and to engage in cross-sector dialogue on issues of health equity and a culture of health. Our objectives for today are really mapped onto our 4 goals. So to really to map onto the lead goal number 1, to illustrate links across social determinants of health via the science, but also the community experience. The second objective is to visualize health equity through the lens of art in communities. The third objective is to identify challenges and solutions in creating a culture of health. And lastly, to highlight recent movements that have resulted in positive change. We really want to learn about our history, learn about what's worked in the past, about really moving a movement forward. We consider the culture of health a movement. And lastly, we do all of this with our advisors. We couldn't do any of it without our advisors. You have them all listed at the tops of your agenda, and you'll see on your agenda those who have a little star next to them are responsible for helping our staff plan and lead this meeting. So I hope you do have an opportunity to meet them today. So thank you for that. That's a general overview of the program. And now I'm going to introduce our leader at the National Academy of Medicine, Dr. Dzau. Dr. Victor Dzau is the president of the National Academy of Medicine, and in addition, he also serves as the chair of the Health and Medicine Division Committee of the National Academies of Sciences, Engineering, and Medicine. He is Chancellor Emeritus and James B. Duke Professor of Medicine at Duke University and the past president and CEO of the Duke University Health System. Dr. Dzau was the Henry Professor of Theory, Practice. Well, so all the bios are in your folders. I really encourage you to read them, because Dr. Dzau is quite an impressive list of accomplishments, and they really cross practice, science, medicine, community level work. He's really quite amazing. So it's my pleasure to introduce Victor.
Thank you, Kimber. Good morning. Good morning, great. So, Kimber, this would be appropriate if my mother was here, but it was painful for me anyway. Good morning, and I'm Victor Dzau. So I want to ask a question first. How many people know about the National Academy of Medicine? Show of hands. And how many people know about the Institute of Medicine? We're the same. Yes, that's right. Thank you. So I want to be sure that you know about us simply because we're not just a quote an academy. We really are a very socially minded organization that brings science and evidence to making a difference to our community, to health and medicine, nationally and globally. And I'm very proud of that. And for that reason, it's just wonderful to see so many of you here from all different backgrounds. So you heard about the Culture of Health. The Culture of Health program, supported by Robert Wood Johnson Foundation, is core to our mission. The activities in this program, in many ways, central to the work of the National Academy of Medicine. Now, what the program has brought to us is an emphasis on culture and equity. And this is extraordinarily important to us as the NAM or IOM. But the program also have taught us so many things. That is, think about new ways of engaging and identifying people. It's beyond the scientists. It's beyond the healthcare profession. It's about the community. It's about the people that we serve. It's about people who are in the artist community. It's about people in the social science community. And so we're so happy that all of you are here, because I think we recognize from the very important study that Kimber mentioned, conducted by Rose Martinez's team on communities in action, pathways to health equity, that to achieve equity, we need to engage everyone across all sectors, because none of us can do this alone. So in engaging new stakeholders, clearly today we're going to, I think we're going to really have a great time working along with all of you and have this program of artists and community leaders. If you have a chance, you can go around this corner here. You see many of the artwork being put up on the walls. And I'll give Joe Miller a shout out. Joe, a Dookie, right? And he's got this great rap, which I saw online, but now as I walk around room 105, there's this great rumbling music out there. So I ask all of you to really learn, know each other, and really try to find ways to really get to know and work together as a team. Now, as Kimber said, we have always brought science to bear. What I think has been successful for us is the willingness to say, what is the evidence for such and such a thing? What do we need to do based on the science, based on the research, but I think we recognize, of course, all that should be clearly intertwined and integrated with so many other sectors of our society. So this is the famous report, which I strongly encourage you to read, and it really emphasizes the pathway to health equity. But I want to just simply tell you that because of all of you and because of the culture of health, we have actually modified our mission statement to put health equity front and central to what we do. This is our mission. If you look at our old mission, these words will not appear. It will be usually science, evidence, advice to a nation. But we have said we want to accelerate health equity. We want to provide, of course, trusted advice, but we want to improve health for all. And by that, not only here, but also globally. So Kimber has led our 5-year strategic plan we just completed, and we're going to implement that starting 2018 for the next 5 years. And I just want to tell you, in the 3 goals that we have, equity, diversity is central to everything that we do. So first, for example, goal number 1, address critical issues and lead and inspire actions on bold ideas to impact science, medicine, policy, and health equity. So what we're saying is, if you look at the project we're doing with you today, if you look at the report in Communities in Action, look at all our other reports, what we're ready to do is to say, we'll take on issues that's important to all of us. And in so doing, we have equity in mind. And that we'll do it in a timely fashion, but also will be bold and inspired in lead actions. So as some of the examples of things we're doing, culture of health, we are also taking on the issue of opioid crisis and really trying to bring communities together. We're taking on the issue of clinician resilience and well-being, a significant problem among the healthcare providers of burnout, suicide. We are also taking on the issue of a healthy aging society. Things like that that really try to make a difference, but importantly, to address the issue of equity. In goal number 2, we recognize that we are membership organization, but of course we work with so many of you who are not necessarily members. However, we need to diversify, and we need to activate not only our membership, we need to engage people like you, leaders, beyond our membership, engage scholars, and so that we can expand our leadership capacity and address the new context and challenges. In this context, I would say that it's important that we look at underrepresented perspectives that can help us see the future of health and medicine, and that we should increasingly be more diverse and inclusive. And we're working on those areas very, very hard in our strategies. In goal number 3, we recognize that we need to expand our capacity across diverse disciplines for the future health medicine. In this case, we talk about the future generations. We all know about STEM education, but we need a lot more people to enter the health field at all levels, particularly people with different backgrounds. I mean, imagine, I just came from a retreat on the weekend and meeting with the social scientists, ethicists, and scientists, bench scientists. And of course, we recognize that you can only advance science and to help if you have, in fact, in mind your social responsibility. So we recognize by engaging future generations, people in high school, etc., that actually that's our responsibility too. Now, that's a very big order for an organization like ours. But we certainly are talking about how we're going to proceed with this and thinking about partnering with education, community, and private sector institutions. Certainly coming from Durham, and I see Kimberly Monroe there, I have some experience in working with the community in how we as a science and medical community can work with the community to enhance education. So those are the kind of things we have in mind to increase health equity. So I think paving the way for health equity, our strategic goals will address important issues and ideas, what's important to society. We'll be more inclusive as an organization. We should ensure underrepresented voices are brought to bear on scientific issues and applications. Certainly, we should expand our reach to be inclusive and to get the perspective of many people, especially yourselves, and reach out to institutions to build a diverse and young pipeline, a pipeline of young professionals. So I asked Kimber, I said, Kimber, how do we know that we succeed? So she actually helped me set the slide. We're asking the question, are the things that we do, convening activities, reports, provide guidance to advance health equity? I think you're the best judge of that. If we're successful, you would say, did you see that output from the cultural health program? We need to bring it to others to adopt it, to disseminate, etc. Are we translating things that we know work in ways that will bring new stakeholders to the table, such as you? Are we informing policy? A big part of course, like it or not, of what we do is greatly influenced by policy. How do we advance our thinking, our findings, to actually have a say in policy and how we determine healthcare access, healthcare coverage, health equity? And are we contributing to community strengthening? And certainly, are we engaging you, allies, in culture of health movement? So I'm very excited about this next 2 days because we have really a diversity of different participants in different communities. But I would say it's really coming together, all of us, that's going to make the big difference. And I'll say one last thing. As an immigrant who came at age 18, I see this as a great country. We've got to make it work. Thank you very much.
Thank you, Dr. Dzau. Always inspiring. Great. So our next speaker is also inspiring. Dr. Jim Marks is the Executive Vice President of the Robert Wood Johnson Foundation. He joined the foundation in 2004. I'm not going to read the whole bio. Let me just preface that. I'm going to read a couple sentences for everybody just to give you guys a grounding. But he did join the foundation in 2004 and currently oversees all programs, communications, research, and policy activities in support of the Robert Wood Johnson Foundation's efforts to build a culture of health. Welcome, Jim.
Thank you, Kimber, for that very nice and short introduction. Good morning to all of you. I'm really pleased to be here, and I'm pleased that you're here at this meeting. Victor was modest in that he didn't talk about his role in helping to get the addition of equity in the mission of the Academy. That's a big step. It's a step that scientists, as he said, sometimes don't realize how important what they do is for society and how important it is that it affects society. Because science unapplied is a sterile discipline, and work in our communities with our people that doesn't have the science that it'll be effective behind it is equally sterile. We're joined at the hip. I saw some of the art. It was really quite remarkable. I commented earlier at breakfast, art is both about and part of culture, health and well-being, and how communities think about that is tied to their culture. And there's a quote that I have always liked by Sir Winston Churchill during the height of World War II, as they were hemorrhaging money and lives. He was told he should cut out the budget for arts and culture, and he refused to cut that budget. And when asked why, he said, if we lose our art and culture, then what are we fighting for? So many of you know that a few years ago, given our nation's long-standing challenges with the rising healthcare costs that threatened to bankrupt our families and our nation, and the persistent large systemic differences in health and well-being between populations, groups of our people, we began at the foundation to realize that what this really means is that our current approaches to health and health care were failing. And we at the foundation had to ask ourselves, what could we do about it? And after pretty extensive discussions with people inside and outside the foundation, we came to feel that our nation had to build a culture of health that enables all in our increasingly diverse society to lead healthier lives now and for generations to come. A culture that recognizes that health is the bedrock of personal fulfillment, the backbone of prosperity, the core of a strong, competitive nation. Good health and well-being are crucial for people to fulfill their hopes and dreams. And that's really why they want to be healthy, to have a long, healthy, fulfilling life. And helping its people thrive is if not the, fundamental purpose of society. The commitment to this vision began by our then CEO, Risa Lavizzo-Mori, has continued with the selection of our new CEO, Dr. Richard Besser. We emphasize that people in communities need to feel that health and well-being are shared goals, that everyone is working together, from everyday folks to their local leaders, leaders from across societal sectors, like education and business and faith and housing, as well as healthcare and public health. That while this is about everyone, there's a special focus on those who are most in need or most vulnerable or feel left behind. But the main thing is that health and well-being of all our people is how we should be measuring the success of our society. As part of that and tied to this is the well-known Martin Luther King quote. He said that injustice anywhere is a threat to justice everywhere. So this means that if injustice, think of that as inequity or disparity in health or well-being, is accepted unchallenged anywhere, then there is risk that the idea of unjust societal behavior and structures can become accepted too, and can spread and can gradually corrode our shared sense of community and nationhood. The implications of this led us to recognize how crucial it is that good change, positive change, has to happen everywhere. It has to spread. When the science tells us something is really a big breakthrough, that we get it out. The other part of it is that we're all interdependent as communities and as a nation. The major health problems of our time, especially as related to fairness and equity in health and well-being, cannot be solved by health care or public health alone. All of our nation's institutions, public, private, and nonprofit, have important and even crucial roles to play. Even those institutions and leaders, if they don't think of their purpose as being fundamentally about health and well-being. Each organization or sector of our society, business, healthcare, academia, schools, urban planning, parks, recreation, banking and finance, agriculture, childcare, etc., has as their core purpose the value they bring to making a community a good place to live, to raise a family, have warm relationships with neighbors and friends, so that people can thrive and succeed. This was a key point in the report that Victor referred to, that report that talked and called out structural racism with its examples of efforts happening in communities around the nation to reverse that. Our institutions must come to see what they can do in decision-making and actions that routinely must include, as they make those decisions, an assessment of the effects on health and well-being as part of their and our culture, not an added peripheral element to their day jobs. Fundamentally, this also calls for transformative thinking in how broadly we in health and healthcare think about how we improve health and well-being. We've been burdened by a narrowness in our thinking about health and where it comes from and how it is built and nurtured and protected and preserved. And this has greatly influenced our civic leaders and the public, so that they have not been nearly as aware that how our society is organized, what our policies foster or inhibit, what our communities encourage and our institutions support are equally as fundamental causes of good or ill health as are the biologic ones. It is research that turns disease and injury from fate's misfortune or bad luck or accident into understanding and potential control. But that research then turns its findings over to society. And whether it is in clinical care or in community health or in education or in agriculture or almost anything else, in the end, it's our policies and laws and practices, the scaffolding of our culture, that must transform research into impact and effect. We're asking you, as some of the allies we would like to be working on health and well-being with us and thinking about what it means in your community, to work together and to think who else should be in this room, who else are in the rooms in your communities or should be in those rooms. When you think of a Venn diagram, we always think of the circles and the overlap. That's not really overlap. It's the areas of interdependence and interconnectedness. It's also a visual illustration of the different perspectives that different groups bring to the same set of issues. You are helping each other succeed. That's the interdependence. We cannot succeed without that other's perspective, without that other's effort in the areas that we think are important. In May of this year, there was an article in the New York Times that said we're not built to live in the moment. It was really an article that, as its secondary headline said, scientists are beginning to recognize that foresight, looking towards the future, is what distinguishes human beings from other animals. That is, we contemplate the future. In the article was very explicit that was not just thinking and projecting the future, but was also about what it means for our feelings and our hopes and our aspirations. It's about learning from what we've experienced, and that our past is not an archive, but our past is something we can look at from different perspectives and see, and it gives us different lessons and greater understanding. And that those different perspectives and contrasts are central to opening up our thinking and offering a variety of paths of action for us as we try to go forward. That brings up another issue that we are dealing with as a society, and that is the issue of differentness. Whether it is differentness related to racial or ethnic heritage or gender or faith or recency of coming to this country, sexual orientation, age, etc. How to address turning our wealth, probably more than any other country, the wealth of the different perspectives we have in this country into the strength it is, and building a shared sense that we're all in this together, rather than having differentness be a source of distrust, divisiveness, and fear that the success of someone else is at my expense. From that negative frame of differentness comes the notion of inequity and disparity, and how divisive it is, and how corrosive it is to our sense of community. How will we grapple with that? Can we recognize that fundamentally people can't truly be healthy if they don't care about and aren't empathetic toward the rest of the community, towards others? The National Academy of Medicine has boldly taken on our nation's most difficult issue, the one that underlies so much of the systematic differences in health and well-being between our people. Now we must begin to build toward the solutions, and we do that first with building the connections, the relationships, the allies, and the partnerships. Without close relationships built around shared values and interests, we'll never have enough money or technology to solve these challenges. With enough close relationships, whatever money we have will be enough. So thank you for being here and joining with us.